Good morning. Welcome and thank you for joining us for week 5 of our Northern Light Health Business to Business Zoom conference. Today's topics are the impact of COVID-19 on travel, food service, and team culture. I'm Dr. Ed Gilkey, the Senior Physician Executive for Northern Light Beacon Health. I'll be your moderator for the next hour. As you are probably aware, the U.S. is seeing a sharp increase in positive cases, with over 50,000 new cases per day. Dr. Anthony Fauci from NIH said, "It is going to get disturbing. I will guarantee you that. Because when you have an outbreak in one part of the country, even though in other parts of the country they're doing well, they are vulnerable." This current surge coincides with states reopening businesses and loosening restrictions, as well as large gatherings of people beyond the impact of reopening business. Maine is one of the states considered to be doing well, yet vulnerable, with an incidence rate through July 5th of 256 cases per 100,000 people. So that's 256 cases per 100,000 people. Compare that to the 867 cases per 100,000 for all of the U.S. And of note, Cumberland County in Maine is at 617. Can we spike in the number of cases? Yes. So keeping Maine doing well is exactly why Northern Light Health is offering these weekly Zoom conferences. The goal is to answer the question, how do we continue to keep our community safe while we open up businesses? We have teams of people across Northern Light Health working to keep our 10 hospitals, 125 locations, including our administrative and financial offices, retail pharmacies, food services, walk-in care services, and bedside care areas safe. We have more than 12,000 employees, thousands of patients, visitors, and customers who are depending on us. So we appreciate the many issues you're working through too, and we hope our experience can help guide you to safely return to business. Before we get started, I will read our legal disclosure. The coronavirus pandemic is an ongoing, continuously evolving situation. Northern Light Health encourages everyone to follow federal and state governmental guidance and mandates. Northern Light Health does not know the particulars of your situation, so the information presented today is general in nature and is based upon NLH's own experience, which may or may not apply to your specific situation and which may be revised as we learn more about the coronavirus. Accordingly, following any guidance Northern Light Health presents today in no way guarantees that you, your employees, and/or your customers and clients will not contract or spread the coronavirus. Please use the chat function to ask questions. You can do this anytime a question comes to your mind. I'll keep track of them and have our experts respond. Also, to help us get a little more detail on how we can best support your efforts, we're going to email a 5-question survey following our Zoom conference. I encourage you to take a moment and let us know if this information is helpful and what topics you would be interested in us focusing on in the future. Let's get started. Our panelists today are Dr. Mike Duffy, Senior Physician Executive at Northern Light Mercy Hospital in Portland. Dr. Duffy is an experienced primary care provider and has been at Mercy for a decade. His innovative nature is serving our southern communities well, as he's helping to reimagine how we deliver care in areas where community spread of COVID-19 is relatively high. Valerie Langbein is the Director of Food and Nutrition at Northern Light Eastern Maine Medical Center. She has nearly 30 years of experience in her field. Her knowledge is incredibly valuable as we navigate the challenges of providing safe meals to our patients and employees 7 days a week during this pandemic. Yamaya St. Clair is an Employee Assistance Program counselor at Northern Light Workforce. She has her master's in mental health counseling from USM and has been supporting employees across Northern Light Health in workplace trainings, leadership coaching, and incident responses. And Dr. Jim Jarvis joins us once again with an update on testing and the latest CDC guidelines for safely managing during this pandemic. We'll start off with Dr. Duffy. I mentioned a few minutes ago how Maine is doing well with keeping the spread of COVID-19 low, and yet we know that Maine is a populous summer destination and we have a lot of people visiting from out of state. Mike, what can you share with us about concerns for a second wave in summer travel?
Thank you, Dr. Gilkey, and hello, everyone. These are common questions right now. I know I'm certainly getting these questions from my own patients. And as a physician, when we look for answers, as we have from the beginning of this pandemic, we look for the data. It's challenging, though, because data itself has been sometimes difficult. Difficult in accumulating and sharing the data, but then also difficulty in interpreting the data. We know that, for instance, we often hear about case numbers. And case numbers, we know, of course, will be directly related to how much testing we're doing. As we do more testing, we expect we're going to see more case numbers. Even mortality or number of deaths has been challenged as both being something that could be overestimated or underestimated. And for that reason, many providers around the country that are looking to quantify disease prevalence and disease severity are looking to hospitalization data, which is what you see on this current graph. On the national level, looking at number of patients hospitalized and confirmed with COVID-19. And what we see here when we look to answer that question about a potential second wave is not very reassuring. What we see here in the last couple of weeks, 2 to 3 weeks, is a reversal of that downward trend that we were seeing previously, and now a spike in that trend. That trend has continued in the last few days. You see the last data point on this graph is July 4th. And the number of hospitalized has continued to increase since then, averaging around 1,500 or thereabouts increased daily in the number of hospitalized. So on a national level, at least, this piece of data is not very concerning. I mean, it is concerning, not very reassuring. When we look at each of these different data points, I think what we find is that each data point tells a part of the story. And so I think it's important to pull in all of the reliable bits of data when we look to answer questions like these, and then try to make conclusions using each different piece of the puzzle. And that's what we're going to try to do in the next few moments. Next question, next slide, please. So other information on the national scale, we look at the number of tests that are being done and the number of new cases being done. And you can see that data here. The number of cases has already increased over 3 million. We see the number of deaths across the country has now approached 130,000. So these numbers are continuing to change and accelerating fairly rapidly as of the last couple of weeks as regions around the country look to reopen. If we look at this next slide, now that we have seen, if we could go back one slide, please. There we go, great, thank you. We talk about the situation on the national level, and that's certainly some of the information that we want to consider. The national level is quite concerning, but what's reassuring then is when we shift our focus to the Maine region. And here, if we look at that same set of data around hospitalizations, but specifically look at Maine, we find a much more reassuring trend here where Maine has succeeded in not just controlling disease prevalence, but also controlling disease severity. The average number of hospitalizations across the entire state of Maine has run around 30, 25 to 30 for the last couple of weeks, and we have as yet not seen that increase in hospitalizations that has been seen nationally. Next slide, please. There we go. This is another important data point. This describes test positivity. And so what we're talking about here is when we look at the last 7 days in this graph, how many tests that have been done have proven to be positive for coronavirus. So test positivity, and the World Health Organization has targeted a 5% or less as the target for test positivity. What we see is significant divergence state by state across the country. Maine is on the really good end of this scale and has consistently stayed well under 5% test positivity, ranging from 3.5% to as low as 1.6%, depending on how far back we look. Very reassuring, and continues to be reassuring on the Maine scale. But alternatively, if you look at the other end of this scale, you see several states that are up over 10%, 15%, or even above 20%. And that is particularly concerning, of course, when we start to consider travel, both travel of tourists to the Maine area, but then also travel of our own friends, family, employees to other parts of the country that may have a greater prevalence of infection. So if we shift our focus then to talk a little bit more about travel, what can we do to ensure safe travel? First off, we want to know the risks. The risks of travel are important. We now have access to data that can give us a lot of information on the prevalence of infection in a particular region. So knowing the location that you're going to, but also the location of the particular function. Is it an indoor function versus an outdoor function? Very significant in terms of its risk. We know that this particular infection does not seem to spread as well outdoors. Group size is also very important. The larger the group and more clustered the condition, the greater the risk of spread. Travel and how you're going to get there is also really important, because as we've established, disease prevalence is significantly different in different parts of the country. Every travel hub presents a convergence of the different areas of different levels of risk. So there's a big question mark when it comes to travel through airports and other travel hubs. How long will you be exposed is important in your travel. That's something else to consider. Your own risk for severe complications. This is something that became clear very early on in this pandemic, is that there are other health problems that will put someone at greater risk of severe complications of infection. And being aware of those is very important. And again, how active the virus is in the area that you plan to travel to, also very important. With regards to resources, I'll add where you might find that information. I've found that we really have been relying on a small handful of resources that everyone can access. First, the CDC, both the national CDC and the Maine CDC websites present very helpful information and access to a great deal of data. Johns Hopkins has a tremendous database of information internationally that is of great use for those looking to answer these kinds of questions. And there is another website called the COVID Tracking Project that some of the information from this presentation came from that I think many will find useful. Next slide, please. So finally, just discussing some of the precautions that you can take. Staying at home if you're ill. Now, this is important. We know that symptomatic patients can spread infection. We also know that it's more complicated than that, because asymptomatic patients can spread infection as well. But certainly the advice remains of staying home if you're ill. Very important. Meet outdoors if you can, and make room for social distancing. When we look at the divergence across states and regions, one thing becomes clear. It's those regions that have successfully implemented these kinds of precautions are the states where disease prevalence has decreased. It's directly related. Wearing a face mask, very important. Maine, I think, on the whole, I'm reassured by what I see when I go out in southern Maine. And as Dr. Gilkey mentioned earlier, this is where the bulk of the infection continues to be. If you just look at York and Cumberland counties, those two counties continue to represent around 70% of the total Maine disease burden for COVID. And so here in the South, I'm reassured for the most part when I go out and I see the social distancing and the masking processes that are happening and other hygiene practices here in Southern Maine. Food service and food distribution is important to take a look at within your group and trying to designate individuals to take care of that. Other activities to allow for social distancing, especially important for kids when you consider activities for families. What kind of activities can people participate in while respecting those recommendations for distancing? And hand hygiene, again, very, very important. Each of these things plays a critical role. And when all practiced together, what we're seeing is reasonable evidence to suggest that we've been pretty successful at trying to control the infection. Dr. Gilkey.
Well, thanks, Mike. And now Val Langbine joins us. Val, many restaurants are open, and that means people are coming together. What lessons can we share with folks about what we're doing in our cafeterias?
Good morning. We can learn a lot of lessons, not just from our own environment here in healthcare, but also looking across the country and see what others are doing. So there's really three things that I would ask restaurateurs to be mindful of. And the first one is to keep our employees safe, because if we don't have employees, we're not going to be able to serve our customers. And so perhaps as a manager, the best thing you can do is to develop a process to monitor the health of your employees. Ask them to actively participate in self-monitoring. They need to be watching for the symptoms of COVID. They need to be reporting the symptoms of COVID. You need to be asking questions of them as well. And we really, really do not want employees who are not well to come to work. So those are conversations that managers need to have with their employees to help mitigate that risk of employee health. The next item is hand hygiene, and I appreciate very much Dr. Duffy's comments about hand hygiene, and you might hear me reference hand hygiene about 50 million times during my few minutes with the group, because it is so, so important. And not just the excuse of a hand hygiene that somebody runs their hands underwater and then dries them off and runs to the next. No, this has to be very mindful hand hygiene to keep those hands clean, and to remind your food service crew that gloves do not take the place of hand washing. So please, again, make sure that those staff have adequate access to hand sinks and that there are easy access. They have easy access to soap and water and also the paper towels. Next item is physical distancing in a kitchen. And notice I put a question mark there because those of you in the field know that spacious kitchens are really well, they're non-existent, shall we say, in most food service operations. So it's really tricky to get that physical distancing 6-foot perimeter around somebody, but it is doable. When it's not doable, be very mindful of other opportunities. Maybe you can stagger your shifts so that you don't have a glut of people at the same time. Now, I realize that's not always possible during meal periods, but staggering shifts can help. Another thing that you could do to help remind your crew about social distancing is to use visual cues, whether it is an X on the floor to remind somebody where to stand, or some kind of a barrier that is going to put space between people. You know, kitchens are fast-moving, fast-paced places, and this requires a little bit of a different thought process in trying to maintain that physical distancing. The next item would be face masks. And again, Dr. Duffy did point these out, and so critical to our success in being able to provide good, safe food to our customers. So one of the concerns that many people have is kitchens are hot, and especially if you're working behind a grill, those pieces of equipment get very hot, and when you've got a face mask on, it's even hotter. So be aware of that, and make sure that you're checking in with your employees to see how they're doing, how they're maintaining, breaking them, giving them a break outside if possible, and so that they can rehydrate as well. The next two items are I put up just because I want to remind people that misinformation is all around us, and certainly there have been all kinds of theories about things that can prevent COVID-19. And from a food perspective, pepper is out there being held up as a potential preventative agent, as well as garlic. And I can guarantee that the pepper is not going to prevent COVID, and the only thing I think garlic might do is keep the vampires at bay, but probably not. Next slide, please. So in addition to keeping our employees safe, we also obviously have to keep food safe. And the good news is COVID-19 is not a foodborne illness, so that's a bit of a relief. And there's really nothing new here that I'm going to talk about food safety. It's things that we do every day, day in and day out, to assure that our customers have a delightful dining experience, minus any food safety concerns. So keep it clean. And I will point out that the EPA does have a list of recognized cleaners and sanitizers. It's from list N. That these are approved by the EPA to be effective. I'd encourage you to go online and just double check and make sure that your products meet that. The other thing that you may not be used to doing is addressing or adhering to wet times. So double check your disinfectants and make sure that you are following the manufacturer's instructions on how to use that product effectively. So in addition to keeping things clean, we want to keep cooked and raw products separate. And of course, the old time and temperature principles are still new, and they're still very usable, very viable, and we all need to adhere to them. Next slide, please. So the final aspect of reopening during this interesting time is that we want to make sure our customers are safe. And so we've got a series of dining considerations, and out is in. Al fresco, what could be better in terms of dining outside in our absolutely beautiful state this time of year? Light breezes, go for it. So we really do encourage dining outside as much as possible. Keep in mind the physical distancing. One thing I will say is that if you've got booths, they tend to be a little trickier to manage, maybe not, depending on your situation. But just be mindful and make sure that your tables and chairs are already set up so that groups are separated. We do encourage people to limit the number of guests in one party to 8. And obviously there's a lot of work that needs to be done in terms of communicating with our customers to make sure that they understand what the expectations are of them right at the beginning. Many restaurants post their policies right on the front door, and I think that that's a good practice. Face coverings. I could have put this on the very first slide, because when customers wear face masks, they actually are helping to protect employees. We want our customers, in fact, I think just yesterday, Governor Mills reinforced the need for face coverings in restaurants in certain counties along the coast and in certain larger cities. So anyway, face coverings for the customers when they come in. Obviously, they do not need to wear face coverings while they're eating. You may consider using single-use menus, those that are paper and disposable. If not, then you'll need to plan in to use laminated menus that can be easily cleaned. Contact tracing is something that you may or may not be familiar with, and we do want people in the restaurant business to keep a log of customers by party, if you will. We need one name and one contact number in case the CDC needs to do some contact tracing. And the recommendation is that you would keep those records for 21 days. I would also encourage you to consider contactless payment options. The less we have to touch shared items, the better. And I would also ask you to think about how you're going to manage the time. You will absolutely want to plan extra time to allow for cleaning between guests. There's a few things that really are probably a thing of the past. So I call these dining dinosaurs. The days of a salad bar or buffet line, I don't see them coming back anytime soon. Um, Planting people or squeezing as many people as you can into an establishment, nope, that's not going to happen either. Multiple use condiment containers on tables, ketchup, mustard, that kind of thing. That's gone by. And I would even question some self-service. You know, there's just so many opportunities. There are just so many opportunities for contamination when you've got a self-service operation. Point is, you're going to have to really just stop and evaluate your operation. Which brings me to my last point, and that would be resources. I'm hoping that some of you do know about Hospitality Maine. They've got a wonderful restaurant readiness training module. Hospitality Maine collaborated with Eastern Maine Community College to come up with some very helpful guidance and even some training and testing that can be utilized with staff to really help you be ready for reopening. And I would also point out to the National Restaurant Association website, because they've got some great resources there as well, and anybody can access those. And that's it.
Thanks, Val. Just a reminder that we're very happy to address your questions, and typing them in the chat room allows us to work through them in an efficient manner. So next up is Yamaya. So much physical distancing is required of all of us right now, Yamaya, making teamwork more important than ever. How can we encourage it, and why is it important?
Thank you, Dr. Gilkey. It really is a great point. You know, decades of research in the field of management and organizational development suggest that teamwork is best in stable conditions, when people have time to learn how to work together. That stability is simply not possible in most workplace settings right now. In the face of these unprecedented stressors, teamwork has become both more important and a lot more challenging. The graph on this slide illustrates common individual level stressors, team level stressors, and organization level stressors many are facing, as well as how those stressors may contribute to attitudes and behaviors that aren't particularly helpful in the workplace. The incessant stress during this pandemic makes it significantly harder for teams to sustain coordinated performance over time. So leaders really need to be more intentional than ever about teamwork. In the following slides, I'll focus in on each of these risk points and provide some evidence-based tips for fostering teamwork under stress. The risk of low morale is very real. Having a sole focus on fears, problems, mistakes, and obstacles will really drain a team's belief that they can succeed. Remember the power of highlighting success, signs of progress, and obstacles overcome. Be intentional about sharing good news with your staff. Really look for where people are doing well and point that out. Another risk has to do with this well-documented fact. When people are under stress, they tend to narrow their attention and overly focus on themselves and the people in their in-group. Natural biases trigger this kind of self-protection, which can dampen communication and coordination. This is why communication is so critical. Help your team members understand how their roles are interconnected. Do this through pre-briefs, debriefs, huddles, however communication works best in your workplace. On a side note here, employees likely need more support than usual addressing personal concerns that may be impacting their performance as part of a work team. If you have resources you can offer, such as an employee assistance program, have those readily available. Another big recommendation is around psychological safety. Employees have to feel comfortable speaking up asking questions, and even offering dissenting views. It's tough to create this kind of culture, but it is really possible. Research shows that one of the strongest predictors of team effectiveness is the degree to which teams feel and perceive they can take interpersonal risks, such as speaking up, admitting a mistake, acknowledging confusion, or offering a dissenting opinion without risk of being punished or rejected. Promote this kind of culture by acknowledging how challenging the circumstances are for everyone, owning and vocalizing how you can improve as a leader, and by thanking others when they participate or admit a mistake. This slide also highlights this risk of an us versus them mentality, which may or may not be relevant in your industry. In healthcare, we've seen frontline healthcare providers rightly referred to as heroes. And though much of the attention should be on supporting these hands-on teams, it's also really important to recognize that others are continuing to work behind the scenes, ensuring that supplies are procured, families are updated, information systems are functional, and more. So a potential fault line really exists between those providing that front-level care or service and those in more supporting roles. So just be sure to look for and acknowledge the contributions of those behind the scenes. You'll see on this slide an emphasis on promoting team mutual monitoring. It kind of relates to what Valerie was talking about earlier. And it sounds a little strange, but here goes. Research shows that effective teams successfully monitor three things: the situation, team performance, and teammates. You can help promote this at the beginning of each shift by reminding people what to monitor. For example, team members can be ready to back one another up if they see someone who appears to be overwhelmed or fatigued, or as Valerie mentioned, if they are showing any signs of illness. Team members can make it easier for their colleagues to engage in this mutual monitoring by openly offering and readily accepting assistance. And this relates back to that last slide about psychological safety. Team members really need to feel safe in order to do this. The last risk noted here is perhaps the most potentially detrimental if unaddressed. It's the risk of low team resilience. The good news is everything I've touched on so far, if addressed, will contribute to increased team resilience, which is really different from individual resilience. I know last week on the panel, there was a lot of discussion about individual resilience, which of course is very important. A highly resilient individual can personally withstand pressure, but that doesn't necessarily mean that they will monitor or support teammates who are under stress. Highly resilient teams take intentional actions to minimize, manage, and mend from stressful events. They minimize the impact by anticipating and preparing for stressors. So they're less surprised when those events occur, and they're better equipped to mitigate the risks. Leaders can help manage stressors by accurately assessing challenges and by providing timely updates. I do have one word of caution here about teamwork, right? This focus on teamwork, as that grows, there's a risk of losing sight of individual well-being. A study in nursing homes found that with a strong teamwork climate, employees were more likely to continue to work while sick rather than stay at home. And this, of course, poses a great risk when we're fighting a pandemic. So remember, while cultivating a stronger team orientation, leaders also need to ensure individual well-being. And the last slide here just offers another way of looking at the primary teamwork mechanisms I've discussed. You'll notice that so much of this is about effective, consistent, intentional communication. If you keep communication lines open and help your staff feel safe speaking up to you and to each other, they'll strengthen their capacity as a team. Thank you.
Well, thanks, Yamaya. I'll draw your attention to the chat room, and Andy has posed a question about teamwork challenges to our group. Feel free to weigh in on that. I also note that Val has shared some perspective using daily safety huddles as a way to help with staff's fearfulness about the pandemic, both for themselves and their family members. So a couple of things to consider there. So Dr. Jim Jarvis is here again today. And Jim, we very much appreciate you keeping up to date and sharing with us the dynamic guidelines for testing as they're changing. So Jim?
Thank you. It's always a pleasure to be back, and so I appreciate being asked to come and speak once again. Good morning to everybody. Usually I'm the one that doesn't have much good news to say on testing, and unfortunately it's more of the same. There is some good news that we have been able to increase our ability to do testing across the nation. Approximately 750,000 tests are being run per day. But I'd remind you that the economies of scale play a big role in here. Even if we were at 1 million tests per day, that would take over a year to test every American just once. And so that's the trouble that we're having now, is that while it seems like we have large numbers, those large numbers do not meet the needs that we have. And then here in the state of Maine, we're the victims of our own success. As we continue to see our positivity rate, or the number of tests coming back positive, decrease, that's a good thing. That means that the prevalence of the disease in our communities is probably lower than it was just a month ago. But we are seeing some increase in positive rates for people who are visiting from outside the state. And as we've talked about before, public reporting is based on the person whose test is, where their home of residence is. So that means that if somebody is visiting from Massachusetts and tests positive in the Bucksport region, it is actually the result is reported as positive back in Massachusetts, as opposed to the area that they actually had the test or where they're currently located at. And so that does add some confusion to some of the numbers, and sometimes it falsely makes people think that our numbers are actually lower in the state of Maine than they really are. The good news is we are seeing less people being admitted to the hospital for positive tests, and that's good news. I will say that we continue to be hampered by supply chain. So we have limited supply of those swabs that we use to collect the specimen, as well as the test tubes and the transport media that those swabs have to be transported in. And even again, yes, those little plastic bags that all of those things get put in for safe transport. So what does that mean for businesses as far as reopening goes? So right now, testing in the state of Maine is very limited and needs to be used really for where we feel that clinically it is significant, meaning those people who have symptoms of COVID-19, or those individuals who need to have tests that may put others at risk during those tests, as well as testing those people that live in congregate living situations, such as nursing homes, group homes, prisons, and the like. And we continue to prioritize those. We have seen that some companies, particularly private companies, have been able to do testing for other means, such as someone who has traveled to the state from outside. And so that testing continues to be expanded. I'm happy to report that Northern Light Health continues to work with the state of Maine on being able to expand out into those areas, as well as looking to private companies that can help run some of the tests and open up some opportunities. If those opportunities do open up across Northern Light Health, we will be sure to be sharing those across social media, and especially with this group of dedicated people who have been listening to our conversations. So what does it mean for you? It means that self-monitoring for symptoms is still our #1 way of helping to prevent spread of disease, and that you should be very, very accepting of when your employees call and say, hey, listen, I am feeling unwell today. I'm going to stay home. Encourage that. In fact, as you reopen, you should be having sit-down conversations with your staff saying, if you feel unwell, we don't want you at work. We want you to go home, rest, take care of yourself, and come back when you're not symptomatic anymore. That'll do 2 things. 1, it helps the employee to get better, but 2, helps to prevent that potential spread. And then, as all of our speakers have said today, we need to continue doing that social and physical distancing. We need to be taking all of those precautions and wearing face coverings, particularly when we are indoors. And with that, I'll turn it back over to Ed for questions.
Well, thanks, Jim. We appreciate that update. So we're heading over to our question portion of it, and I will be grouping similar questions together just to make sure that we get to everyone's question. I'm going to start off, though, pointing out that Julia shared a comment with us in response to Andy's posed question that I think you might have a response to add to. She tells us that while most of her staff are working from home, she seems to find that that people are really quite a bit more sensitive over the last few months, and there are fewer outside distractions for staff to think about. No school functions, no extracurricular activities, no quick trips to the store to window shop or browse, no family and friend gatherings. So it seems to be all work and very little play. And that has increased the sensitivity level of some of the staff, and are prone to stress easily and or be anxious prior to all of this. So you might maybe some comments about that, any tricks of the trade, so to speak.
Yeah, it is a really good point, and we're definitely seeing this among employees, many of whom have switched to working remotely and didn't recognize how much social interactions happen in the average workday that they really miss, whether it just be walking, down the hall, talking to someone, or that brief kind of informal time often at the beginning and end of meetings that is just awkward and missed in most virtual settings. So being really intentional about creating some spaces in your workday to connect socially and provide those opportunities for social connection among staff is really critical. And just, kind of reevaluating the workday. We see a lot of research does indicate that people who work remotely tend to actually put in longer hours, somewhat from fear of being seen like they aren't working hard enough because it's not visible, and sometimes because there is that lack of separation between life and work, and so it's kind of they're on 24/7 responding to emails and doing different things. So intentionally setting up having those conversations with your staff and helping them set some boundaries around their work, and then creating some more formats for some social interaction with people, potentially even shortening meetings and encouraging people to take a bit of longer breaks between meetings and do something physical could be really helpful.
Oh, thank you, Maya. The next question is for Dr. Jarvis. This is from Claudine. How are employers documenting the results of either employee self-checks prior to the start of shifts or screenings at work? Are we required to document this?
So that's a great question. I'll answer the second part first. You are not required to document this. We just consider it a good idea to keep at least some track of what's going on within your workplace. Many employers are not actually documenting or keeping track of what their employees are stating. In fact, at Northern Light Health, we do not do that monitoring. What we do is we just simply monitor the number of people who answer positively to any of our questions. We did this initially because we wanted to make sure that we were protecting the privacy of our employees, and we also want to encourage them to be honest while they were giving us the answers to those screening questions. I think most of our employees now feel very comfortable with answering those screening questions, and most would stay home prior to even arriving at our facilities so that they wouldn't even have to answer a positive question. And that's really what I think you need to encourage your staff to do. If they're feeling unwell, no sense coming in and having putting everybody else at risk while they go through the screening line and then going back home. Rather, just encourage them to stay home to begin with. So I hope that answers that question.
Yeah, that was great, Jim. And actually, that ties into a question we just received from Kara, so I'll stick with you as our responder. If an employee is sick and stays home while unwell, how long should they stay home? And there's a series of questions here that come together. At what point should they return to work? Is there a certain number of days they should be symptom-free before returning to work? Also, in regards to COVID exposure protocols in an office environment, should testing be required and who would be required to test? So a couple of questions, but I think they all come together.
They do come together. And so again, I'll answer the last one first. So if there are some exposures at work that of a person who has a known positive COVID test, then reaching out to the main CDC would be my first recommendation for you, and they can assess whether or not they need to do contact tracing and whether or not testing of other employees, staff, customers, clients is warranted. They would be your best source of information for that. If you do have an employee that feels unwell and is staying home, I encourage them to call one of our state triage lines, including the triage line set up by Northern Light Health, where a health professional can review their health history, go through questions to determine whether or not they have symptoms suggestive of COVID-19, and if so, recommend a place where they can go to be tested so that you can get a definitive answer as to whether you're dealing with COVID-19 or any of the myriad of other health concerns, such as the common cold, influenza, or other things, and help to kind of tease that out. If it does turn out to be COVID-19, we do recommend that an individual not return to work until they have had at least 3 consecutive days of improving symptoms, and that they remain without a fever for 3 days off of any medicine that helps to reduce fevers, such as Motrin, ibuprofen, Tylenol, or acetaminophen. And so once they've met those criteria, we do recommend that they can come back. Some industries have looked at test-based return to work, meaning that the individual needs to have a particular period of time where they have remained asymptomatic, then they get tested again, and if they're negative, they can return to work. We tend to use a time-based method, which really includes having at least 10 days after their symptoms start, and then again, those 3 consecutive days of improving symptoms and then not having a fever.
Great, thank you, Jim. Our next question is for Dr. Duffy. This comes from Edie. Are we still in the first wave of the virus, or have we entered the second wave with all the spikes nationwide that we're seeing? If we are still in the first wave, how and when do you think we will enter the second wave? So that's actually kind of troubling to try to figure out what's being expressed on the television each day. So what's first wave, second wave, and what can we expect going forward?
Yeah, it's a question that we hear a lot right now. It's a topic of conversation. In my mind, it's a matter of perspective. When you look at the national data that we just did and consider a national perspective, it's hard to argue against the idea that we've entered a second wave. Or you might also say we never fully succeeded in controlling and completing the first wave when that hospitalization data has done that curve that we reviewed. So from a national perspective, you could say one of those two things. Local perspectives will differ dramatically depending on which part of the country you're in. Here in Maine, when we look at our data, there's no reason to believe we've entered a second wave on this at all, and we seem to be doing a very good job of continuing the downward shoulder of that first wave. Elsewhere in the country, say Georgia, they may think that in their perspective, they're really just now getting their first wave because they're really starting to see the first significant uptick in dramatic numbers of case volume and hospitalizations. So I really think it's a matter of perspective. And as for the second part of this, when will we expect to see a second wave in those areas where we may be completing the first wave? My prediction, and again, it's just a prediction, is what we're left with this. But when we look at the experiences from elsewhere in the country, I think the best answer to that would be whenever we're unable to do the functions that limit disease spread. So when we see around the country the areas that have been successful, like Maine has, in controlling spread, it's physical distancing and hygiene and masking and quarantining and all of the other efforts. If we let up on those, or we're unable to do those things, then I think that is when we might expect to see a second wave. And I think that rule probably holds true just anywhere that you are, as long as the disease conditions, the pre-existing conditions, are there, meaning adequate crowding and some prevalence of infection.
So thanks, Mike. I'm going to follow up a question for you. I mean, this is a really interesting part of the whole concerns that we have. We'll point out that in Maine, collectively, everyone's done a very good job of flattening that curve. So like you described, we're still playing out the first wave here. But there's a lot of confusing information as we're hearing about, greater than 50,000 new cases per day in the country and different hotspots again. What's really confusing is the cases are up, the deaths seem to be down, and we're beginning to hear, well, that's good news, the deaths are down. And then I'm kind of concerned that people are thinking, well, you know, maybe this isn't very serious. So recognizing that we have the great benefit, good fortune of a low prevalence rate collectively in Maine and have flattened that curve, and I think it's relatively safe in Maine compared to other places. Could you help us to understand how serious really is this coronavirus?
Oh, it's very serious. It's very serious. Make no mistake about that. There's a couple of explanations for that decrease or the delayed increase, at least, in death number. And I wish it was because we've discovered a cure for this, but we as yet do not have a cure for this infection. We've probably gotten better at treating it, and some principles of treatment have shown to reduce hospitalization duration, but not yet proven any particular intervention to significantly reduce risk of dying of it. So that's not the case. But what is the case is a couple of different things. Number one, we're testing more, and not just testing those at greatest risk. So we are now expanding testing to younger people and people without those pre-existing medical conditions that put them at greater risk. So when we expand that testing, then we get a greater number of positives, and we're increasing the pool of positives, and many of those patients don't end up significantly ill, or even now by other means testing patients that are asymptomatic and never proved to be symptomatic. So that dilutes the pool a little bit relative to where it used to be, and that will affect the death rate among positives. So that certainly counts for a significant amount of what we see in the death count. The other piece of this too is that the death count is a trailing indicator. It's the last of the results to come through, and what we see is that there is quite a process that takes place between the spread of an infection in the community, the presentation of the symptomatic individuals, the progression of those symptomatics to require hospitalization, and then ultimately, fortunately, a small proportion of them will succumb to the infection. But that takes some time, and I suspect with the increasing counts that we're seeing, and in particular that increase in hospitalization data, it's just a matter of time before we start to see that death count is going to start to climb, and I think we're starting to see early indication of that now.
Yeah, so that lag indicator will show itself eventually. I'll just reinforce, this is an extremely serious virus, and what we need to collectively do, all our participants, and influence all the people that we work with and our family members, is to reopen in an intelligent manner. I think that's critically important. So our next question is actually for Val. Val, I apologize, Valerie. Do food preparers need facial coverings considering how hot the kitchen is?
Well, you know, wouldn't I love to say no? But the reality is, as I described earlier, we really, in kitchens, you're just gonna day in and day out frequently be closer than 6 feet to somebody. So I really recommend that face coverings be worn even in hot kitchens. It's not a real popular statement, but it's true.
That's a tough one for sure.
Yep.
Thank you. Umaya, the next question is for you. So how can you know the team has an appropriate amount of work, considering that the overall stress may make them less productive, and we don't want to overburden them? We want to have it balanced, but maybe we have a new set point as far as what to expect for productivity. Maybe you can comment on that.
Yeah, it's hard to know, right? And there's no really simple answer here. I think it comes back to, again, having really open lines of communication. If there are projects that are not particularly time sensitive and can be put off to a later date when we have things a bit more under control, I would encourage leaders to do that and really really just look at prioritizing the work and helping your employees prioritize the work as well. So they know, what's most necessary to get done, and what is if there's enough time kind of task. So again, just really keeping those lines of communication open, and also consistently checking in with how things are going for your employees. There's a lot of invisible work that we don't necessarily always see or know as leaders. And so getting a really good inventory from folks of, hey, let's check in now that we've switched really how we're going about working. Can you just kind of walk me through a typical day of yours, and how you're organizing your day, and what you're doing, and where you're experiencing challenges, and where you may need some help prioritizing? Really, they're going to be the experts on how they're organizing this, and where they need some assistance. So listen really well, and then make modifications accordingly.
Thank you. Val, the next one's for you. What's the best practice for menus? Is there a risk with using menus like we always have done?
So assuming you're talking about menus as in the physical menu that you would give to a customer. Yeah.
Yes.
I do like to, well, we'll just put it this way. I like to be overly cautious. And so I do think that it's a good idea to use a disposable menu, or maybe a menu board that nobody actually physically touches. So I wouldn't use a menu that's going to be reused by a bunch of customers unless you have a mechanism to clean them thoroughly in between customers. So again, it's another step, but I do feel that that is an important part of the process.
Okay, well, thank you. Next question is for Dr. Jarvis. If an employee goes out of state on vacation, can and should they be tested before coming back to work?
So the question really is, where did they go and travel to? So if they travel to one of the states that the governor has exempted from needing to quarantine or be tested to not necessarily be quarantined, then no, they do not need to follow those guidelines. But if they go to any other locale other than those states that have been identified by the governor, then yes, they are expected to quarantine upon return. It is up to the individual or the employer, if the employer wishes to get involved, to determine whether or not testing should be done in order that they don't have to spend those 14 days within quarantine.
Great, thanks. So that's part of that dynamic testing situation that we've been talking about. And I'll reinforce what you've already been told earlier today, that the main CDC website is a treasure trove of very up-to-date, useful information, including the details that Dr. Jarvis was talking about just now. So I encourage you to go there, and you can also set up yourself to get notifications for any changes that occur in the course of the day. So that's helpful. The next question is for Dr. Duffy. What are your thoughts on airplane travel? How safe?
That's a great question. And I think the best answer is it depends. It depends on how it's done. Are the others on your airplane masked, distanced, and practicing appropriate hygiene? How big is the airplane? How crowded is the airplane? How long are you on the airplane? Those that are reassured by air travel will point to air circulation within the cabin, and that certainly is of benefit. But my feeling is that unless all of those other things are done well, then it's a significant risk. And when you add in that when you get on an airplane, you're getting on an airplane with people that are coming from all other parts of the country. You don't know where they've come from, what they've been exposed to. You add in the risk of asymptomatic transmission. It's concerning. My recommendation is that should be approached with great caution.
Great, thank you, Mike. And that's it for today. Thank you, panelists. Just a reminder, we will be emailing you a survey right after our conference. Please be sure to give us your feedback so we can continue to provide relevant information and insights to collectively and safely reopen Maine. We hope you have found the last hour a good use of your time and you were able to identify some useful tips to apply to your business. We are planning to offer this session every Thursday from 11 a.m. to noon for the foreseeable future. If you have ideas for content, please let us know. We will send you the link along with the topics for week 6. We encourage you to share the invitation with your friends, colleagues, and others who might benefit from this information. By working together, we will help Maine safely open back up for business. Thank you and have a good afternoon.